Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Dusablon, your host for today's show. Franklin County Home Health Agency is your local nonprofit home health care and hospice organization that has been bringing services to families in Franklin County since 1969. Through this monthly show, we bring you information about our agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. Today we'll be talking about one of our services, and with me today is the Nurse Family Partnership Supervisor and our Maternal Child Health Clinical Nurse Manager, Rhonda Desrochers. So Rhonda, thank you for being with me today.
Thank you for having me, Jen.
So we just recently celebrated a Nurse Family Partnership graduation.
Yes.
Here in June at the agency. So that celebrated families that have been through this program. So tell our audience what the Nurse Family Partnership program is.
Well, Nurse Family Partnership is a community program that's also community-based, and it provides support and education to first-time moms who qualify for the program.
Great. And when you say community setting, this means in their homes or in a place that they call home?
Yeah, I'm glad you asked, because it is home-based basically, but we also realize that there are moms who may not have a home, or maybe they live with somebody else, so we just meet them wherever they're at. So that's the reason why we call it community-based.
Awesome, good. So the Nurse Family Partnership is relatively new in home health care, but we have had a number of successful years. So can you tell us some of the numbers about kind of referrals and people that have been through the program?
So we actually started the program in 2012, and that's when it started in the state. We were one of the first programs to start in the state, and so we've been up and running for 5 years. We've gotten, and we do, I just want to say that we do cover 3 counties. So we cover Franklin and Grand Isle and also Lamoille counties. So we cover a really large area. And to date, we've had about 450 referrals, and we've enrolled about 185 families. Right now we have 64, but that's going up. I know that we have some enrollments coming up in the next couple of weeks. And then last night, you talked about our graduation. We graduated 12 moms last night, and that brought our total graduates up to 39 altogether. Because when a mom does enroll in the program, we like to start visiting during the pregnancy, and we're available to that mom until the child turns 2.
Wow.
So it took us a couple of years to even have our first graduation. So last night was our 3rd graduation.
Great. So that means people who have really stayed through the program from the time they were pregnant until their child turned 2 years old. That's quite an accomplishment.
Yeah.
So
well, we're proud of our moms too, because that's 2.5 years is a long time to stick with the program. So yeah, we're proud of them.
That
and
says a lot about the program too, I'm sure. So give some more information. Do they start before they're pregnant all the time, or is that one of the requirements, that they're pregnant at the time of referral?
Yeah, so I said to moms who qualify, and so in order to qualify for the program, a woman has to be a first-time mom, so her first pregnancy, or at least going on to have her first baby. And then they have to be under 28 weeks of gestation, and also there is an income eligibility.
Sure.
It's pretty generous, but yeah, there's an income
Sure, and
guideline.
because the program for the family is no charge to the family, is that correct? Or
That's right.
Yeah.
A free personal nurse.
Yeah, that's really cool.
Yes.
Yeah. Why is it important that they start 28 weeks before gestation?
Well, we find that it's good for mom and the nurse to build a relationship. That would probably be the most primary reason. But also, first-time moms have a lot of questions, and they need some support during that time. So we find that just giving them that extra time during pregnancy builds the relationship between mom and the nurse, and also gives her plenty of time.
Yeah, that's smart, because once the baby comes, the time
goes
out the window.
and we want to support moms in their desire to have a healthy pregnancy, and so if we can start early in the pregnancy, then we can have more of an impact.
Yeah. So you're talking your healthy pregnancy, we're talking healthy newborn,
yes,
healthy early toddler, you know, when you're 1 and 2. So those are all really different stages.
Right.
So talk about our staff, if you would, for a second. You have to be quite expert at a lot of this to be staff, and you and your nurses.
I have 4 nurses, Jess, Becca, Alaya, and Allie. And like I said, we cover quite a large area. So Alaya covers just Lamoille County, and then the other 3 nurses cover Franklin and Grand Isle. They all have varying degrees of education and experience, but all of them love moms and babies. We're really passionate about what we do.
It's great. Your office is the most fun.
It is.
Cute pictures everywhere.
We like to think so.
Adorable patients and babies and families.
Yes.
So what is mothers who are in the program? What is a typical visit like? What can they expect? I mean, it's going to be different at any stage, but how often? How long is a nurse with them? Just some information.
Yep. So we find that a lot of moms really like to have a schedule of visits that go from 1 to 2 weeks. We do like to have more visits in the beginning because we want to build that relationship, but it's really kind of up to the mom after that. We offer visits as often as every 2 weeks, but we're very flexible in that, just like we're flexible in where we meet moms. And then, like during the visit, once we get to the home, we check in with moms, like how are you feeling today? Are you even wanting to have a visit right now? And checking blood pressures, and if the baby's here, we weigh the baby and we check in with the baby's health. And we work a lot on baby development and toddler development, so it's really about what the mom wants,
So you talk with them about where
exactly,
and I'm sure talk about your relationship with. They have doctor visits and they have new wellness visits and stuff. How does that all relate to each other?
Well, that's a good question because we can support them around those visits, and if they have more questions, doctors do a really great job, and our pediatricians in the area are really great, but that is pretty time limited, and we have the time and the resources to kind of answer all those questions that moms have about what babies are going to be doing right now, what's my toddler going to be doing, how am I going to potty train, so.
Wow.
And I think, most moms feel like it's really supportive.
That's a lot of, it can be an overwhelming time, and you're there to really help them put those pieces together.
Yeah, and, so it just goes back to, we check in medically because we are nurses, so we want to make sure that everybody's healthy and that those questions are answered. And then we go into talking about something that the mom has chosen to talk about. But then after that, as nurses and doing this for a while, we kind of know what to anticipate, and so we cover those things as well.
So you can say to a family, you may not have considered this, but let's talk about a topic that you found to be important to other moms, and maybe they want to learn more and maybe they don't, but it's a partnership so they can tell you.
Right, and it's a first, it's a first-time mom, so there may be questions that they didn't know that they had,
Oh, absolutely.
So,
Well, that's great. What? So it sounds like you're not tied to a set number of visits that they have to have. It's very flexible. But what else is expected of mom in this program?
Well, just a desire, really, to have a healthy pregnancy, which most moms do, of course. I mean, I would hope that all moms do, actually, but and just have a have a desire to do well.
Yeah. That's excellent. How about other family members? How do you support the whole family?
Well, it's really up to the mom who she wants to be part of the visits. We welcome questions from everybody. We know that families are
different.
And also they're a big influence, and they're a part of this baby's life. So it's really important that they be included.
Yeah, just
absolutely
thinking that just last night at the graduation, you had people there to show support and clapping for their mom and the graduating 2-year-old, and so I just wondered how that worked out. But so this has been here in our agency for 5 years, as you said, and you do a wonderful job trying to get the information out there in our community, but remind folks how they would find the Nurse Family Partnership if they think this is something that they, if they're newly found out that they're pregnant or they know of somebody who's a first-time mom, how can they get in touch with you and how can they be referred to the program?
Most of our referrals do come through the WIC, Women, Infant, and Children, or the Health Department, and from the OB offices. So I would say if you're at a WIC appointment or you're at your doctor's appointment, ask them about the program if they're not offering it. But also just calling the agency at 527-7531, which I'm sure we're going to say that again. Yes. But and also our the Franklin County Home Health Agency website. We're also on Facebook, yes. You know, and there's a lot of information there about Nurse Family Partnership as well.
Yeah, don't be shy. Give us a call and
please.
See if it's the right fit.
And we do have that quite a bit actually. Yeah. We have moms calling us directly. So
well, good. You don't have to wait. You can give you a call.
Yeah, give us a call, please.
Yeah. Tell me, so you had mentioned, it's important to mention that we, as Franklin County Home Health Agency, we're one of the Vermont's nonprofit home care agencies that usually, divide up the state. We're in Franklin County, but this program works with Grand Isle and the Moyle, as you said. Tell us about the national. It's a national program too, though, right? Can you give us some history to the NFP or some national data?
Nurse Family Partnership has been around since the early 70s, and it was created or developed by Dr. David Olds. The numbers keep on going up, but I think there's 40 to 45 states in the union that actually have at least one Nurse Family Partnership program. But it's also international. It's in England and Ireland, so there are some international sites. In Vermont, we started out with 6 counties, our 3 counties, and then the Northeast Kingdom. But now it's gone on to spread to 12 counties in the state. So 12 out of 14 counties in Vermont are implementing Nurse Family Partnership, and we're all pretty successful. Yeah. The funding, when the Affordable Care Act came out, that created a program called McV, and I won't go too much into that because it'll be too much, but it funds a lot of these community-based programs, and that's what funds our program.
Yeah, that's important.
Yeah, so it's a federally funded program.
Okay, wonderful. Talk about, this is one of the programs at Franklin County Home Health Agency that focuses on moms and their babies, and it has its own outcomes and successes, markers. What are some of the outcomes that are the goals of NFP specifically?
Well, our 3 overarching goals are healthy pregnancies or healthy pregnancy outcomes, healthy kids, getting kids ready for school, it's really important, and also just to help families or support them in being independent and self-sufficient. So we do a lot of work around that.
And that's so important to the families and to all this community. Yeah, wonderful. So as I was saying, it is one of the programs at Franklin County Home Health, but there are other ways that the agency supports moms and babies. Can you talk about some of the other programs that are at the agency? Well,
we do have one other community-based program called MESH, and that's Maternal Early Childhood Home Visiting or Sustained Home Visiting. It's much like Nurse Family Partnership, but we have a little more flexibility in that program to enroll moms who are not first-time moms, and also we have up until 6 weeks after the baby's born to enroll moms in that program. Now, if you're a family who miss both of those cutoffs, we do have Children Integrated Services nursing, which is still very supportive and educational for maybe families that have an older infant.
Yeah, okay. Good. So, because I know, and I don't know if it's changed, but when I had a child and you leave the hospital, they mention home health services, they talk about breastfeeding support.
That's right.
Can you talk a little bit about that as well?
Mary Stewart Bullock is our lactation consultant, and she's fabulous. Now, she's not the only one that does our lactation visits. We're all lactation counselors at least. And yeah, we get a lot of referrals from the hospital for moms who are breastfeeding, and we go out and mostly it's answering questions about breastfeeding, but also there are breastfeeding challenges, and we're definitely equipped to help moms with those as well.
Good. That's
Yeah.
good. And that leads to healthy
Yes.
babies as well. Yeah. So anything else that you can share with us about nurse-family partnership? Maybe, we heard some wonderful stories yesterday from patients. Can you talk about some of the, privately, about some of the experiences moms have had and what they've shared with you about their experience?
Well, during the program, it is a 2.5-year program if mom decides that she's going to stay for until the child turns 2. So we get to know a lot about families and their struggles and their challenges. So some of the successes that we've had are around, for instance, depression. Postpartum depression has been pretty significant. We didn't really understand how significant it was until we started this program and started asking moms those specific questions. So we did start a postpartum support group, which is called Baby Bumps, and we meet the second and the fourth Tuesday at 5:30.
Is that for anybody, or is that
That's
this
for
program?
anybody.
Oh, great.
Yes,
Baby
anybody
Bumps.
can come to that. It's called
Okay.
Baby Bumps, and it's at the hospital on the birthing unit. And we have a pretty good turnout now. We have 4 or 5 moms going to that group, and so anybody's welcome to that. But it really opened our eyes to postpartum depression, but also speaking about moms last night. Moms are going back, they're building confidence, and they're going back to school, and they're going to work, and they're continuing on their education if they have a high school diploma. We've had moms who have started college or college programs, so yeah.
That's really great. Thanks. There's so much more. You are focused on medical, but so much more to the whole well-being of the family.
That's right.
That's super. Well, thank you, Rhonda. We're very lucky to have you and those nurses at Franklin County Home Health
Thanks.
here locally and in this northern part of our state. And before we close today, I just ask you once more if there's anything you'd like to share about Nurse Family Partnership or working at Franklin County Home Health Agency.
Well, it's been a really exciting 5 years. Nurse Family Partnership, most nurses who have worked in maternal child health had heard about the program before, and that's sort of what drew me to Franklin County Home Health. It was one of the first agencies that was wholeheartedly interested in supporting moms and babies in this community, and so they took on the program, and I applied for the supervisor position because it was Nurse Family Partnership.
Awesome.
But now that I've taken on the maternal child health nurse manager role, it's just a great program to be a part of.
Yeah, so you had
Very
worked in other
supportive.
settings before that were not home care based. And
Oh, yes.
yeah, so
yes.
talk about the difference that you're finding with home visiting.
Well, I've been doing home visiting for a long time,
Yeah.
for 15 years. But before that, I worked on a pediatric unit. So going from the hospital to home visiting,
Time.
well, home visiting for me has worked really well because it's super flexible. It's a really flexible schedule, and you get to actually go out and build relationships with people, and that is so satisfying, and fulfilling to build that relationship with your clients and go through a journey with them, basically. Like, you start with a first-time mom, and it's a journey into motherhood, and for some of our younger moms, a journey into womanhood.
Sure. Yeah.
So,
oh, what a gift to be able to
yes,
witness that.
it is
That's
a
great.
gift.
Oh,
Absolutely.
wonderful. Well, thank you, Rhonda. Thank you for the work
welcome.
you do here locally, and thanks for sharing information.
Thank
And
you.
we will be sure to post some information on the Franklin County Home Health Agency website about the resources Rhonda mentioned, the support group, and phone numbers that you can reach us at. So again, our phone number at Franklin County Home Health Agency is 802-527-7531, and we do hope you'll friend us on Facebook. You can find information there about job postings, working at Franklin County Home Health, about events and programs, and our news in general. So please look us up on Facebook as Franklin County Home Health Agency. And again, thank you for watching, and be well.